we are going to see the key muscle of the infratemporal region, that is the lateral pterygoid. In this video, I am going to discuss the origin, insertion and relations, all the relations of the lateral pterygoid in the infratemporal fossa. We are going to see the origin of the lateral pterygoid. It arises by two heads, upper and lower. The upper head arises from the infratemporal surface and infratemporal crest of the greater wing of the sphenoid bone. The lower head arises from the lateral surface of the lateral pterygoid plate. Then the both heads proceed laterally and backward and converge to form a tendon which is inserted into a depression in front of the neck of the mandible. Here the mandible has been cut at certain portion to show the deeper structures. This is the condylar process of the mandible. In front of that you have the coronoid process of the mandible. So the tendon is inserted into the depression in front of the neck of the mandible and partly to the articular capsule of the temporomandibular joint and the articular disc of the temporomandibular joint. The muscle is mainly supplied by a branch from the anterior division of the mandibular nerve. Now we will move on to the relations of the lateral pterygoid. The superficial relations of the lateral pterygoid are: first one, the masseter muscle, which is cut in this diagram, which was present over this region. The masseter muscle, that is the first superficial relation. The next one is ramus of mandible, that's also cut at this region, that also comes in front of the lateral pterygoid. Not in front, that is superficial to the lateral pterygoid. Then comes the tendon of temporalis. This is the temporalis muscle, and this muscle converts to form a tendon which is inserted into the coronoid process of the mandible. That's also has been cut in this diagram for a better view. That's also lying superficial to the lateral pterygoid. Then here comes the maxillary artery, that is lying superficial to the lateral pterygoid. So these are the superficial relations of lateral pterygoid. At the upper border, this is the upper head of the lateral pterygoid and this is the upper border region. At this region, you can see the deep temporal nerves are emerging and the masseteric nerve also emerging at the upper border of the lateral pterygoid muscle. At the lower border of the lateral pterygoid, you can see the lingual nerve, the inferior alveolar nerve, the sphenomandibular ligament and a middle meningeal artery, which we will be seeing in the deeper section of the infratemporal fossa. The structures passing between the two heads of the lateral pterygoid are the buccal branch of the mandibular. You can see a small twig of nerve over here, that is the buccal branch of mandibular. Then the maxillary artery at the junction of second and third parts. This is the second part and deeper one will be the third part. So the junction is lying between the two heads of the lateral pterygoid muscle. This diagram shows the structures visible in the infratemporal fossa once a part of the lateral pterygoid is removed. So this is the lateral pterygoid, this is the upper head, this is the lower head, and lateral here it was the temporomandibular joint and the neck of mandible was there. So the insertion was towards this region. So this much part of the lateral pterygoid is removed in this diagram. So what we are seeing here will be the deep relation of the lateral pterygoid muscle. So here this is the foramen ovale from where the mandibular nerve emerges outside the cranium. So this will be the posterior trunk of the mandibular nerve and this will be the anterior trunk of the mandibular nerve. So these will be the deep relation of the lateral pterygoid. Now we can see the chorda tympani nerve joining to the posterior aspect of the lingual nerve. This is the lingual nerve. This is the lingual nerve. The chorda tympani joins to the posterior aspect. The chorda tympani is a branch of facial nerve. Then here, this is the middle meningeal artery, which is a branch of the maxillary artery passing between the two roots of the auriculotemporal nerve. That is also a deep relation of the lateral pterygoid muscle. And finally, you can see the deep part of the medial pterygoid muscle in this region. That's also lying deep to the lateral pterygoid muscle. These are the relations of the lateral pterygoid.